Hello there. Happy Friday. Thank you so much for joining me today. And if you're joining us live on this Facebook, thanks for being patient. We just got it started. You know what? Every time I log into Facebook, there's something new, and the technology has challenged me this week for sure. So, if we haven't met before, my name is Julie Hirschberg. I am the owner, founder of Re+active Therapy and Wellness here in the Los Angeles area. We are a neurologic therapy center with physical therapy, occupational therapy, and psychology, working with people to recover their their activities. And that's where reactive comes from, by the way, if you haven't heard that term before. But also, we do a huge amount of education with therapists. And I do a lot of reading as I'm learning and sharing with a lot of other people. And I just love reading. If you haven't met me before, that is something definitely known for me. And one of the things that I really love to do is look at what's the latest in the literature, what's coming out in journals. And there was a special journal that just came out focusing on functional seizures. So the journal, by the way, I have all of these articles up in front of me. It's Epilepsy and Behavior Reports. And they did a special series, the whole journal on functional seizures. And as soon as I saw it, I follow all of my favorite authors on Twitter. As soon as I saw a tweet about it, I was like, oh my gosh, I downloaded the whole thing because this is an area of a lot of interest for me. We work with a lot of people who have functional seizures, and I'm just so curious and wanting to understand more and more and more. So I get curious, I read, I process that, I put it into what I know clinically and share it with you. So here I am today. Something else that I saw on Twitter that I had to share with you all, and this kind of leads into the first part of the topic too, is one of my favorite authors just shared that the DSM, which is the diagnostic tool book for psychologists, psychiatrists, just changed at last conversion disorder to functional neurologic disorder as the title. And this is huge. I was so excited to hear this. Now we just need our diagnosis codes to catch up because some of our diagnosis codes still say conversion disorder, and it's just so misleading. So anyway, that is really exciting, and it brings me up to this first part of the topic, but from this special issue. So the special issue had many articles on functional neurologic disorders, the history of functional neurologic disorders, functional seizures. It's a great issue. You can download the whole thing free full text, which, by the way, if you're on our newsletter, I will put the link in for you. And I'm going to hit on some of the highlights that I really found in reading this. And if you have questions, by the way, I'll take a look at the comments. I'll respond to you as I catch those. So the first piece I wanted to hit on is the history of functional neurologic disorder and why it is not just conversion disorder. And even our psychological manuals, our diagnostic codes are finally catching up, which is exciting. Because it's not just convergence disorder, but I do think it's interesting to look at the history. So the one of the articles in this special issue was called A Historical Review of Functional Neurologic Disorder and Comparison to Contemporary Models. So this was Rayner and Baslett, and they actually did a really beautiful job of bringing this really interesting history of functional neurologic disorders, by the way. And yes, Jamie commented how exciting to see the name change. And this history kind of highlights that. So there were a few things in here that I didn't realize. And one of them, and I've looked at some of this history, so this particular piece I really hadn't seen. So there are texts as old as 1900 BC, Egyptian text that reference unexplained symptoms, and this is so interesting to me, that were attributed to uterine dysfunction. And so they actually, and this isn't surprising, this, we have a whole history of hysteria as well, and things that are attributed to particularly women. That this particular description where they had, it was the pain of a woman whose eyes were aching until she cannot see, on top of aches in her neck, and it was suggested that this was to be caused by discharges of the womb in her eyes. And so scholars have suggested that this might be the first recorded description of FND, referencing this wandering womb, which was a piece of ancient text. This really makes me want to read some ancient text, by the way. This claim, obviously, has since been challenged for sure, particularly this like wandering uterus idea. I think this also really points back to just a lot of not understanding women, and also misattributing things to a women's hysteria, which is kind of the next piece in the timeline. That hysteria idea really came from this kind of reproductive organs causing the problem, and causing some of these unexplained symptoms. This article actually has a really lovely table going through some of the broad categorizations of these themes that have come up in the history of FND. So supernatural things, reproductive organs. The next piece of that was really the idea of conversion and disassociation, and that these symptoms were primarily due to psychiatric reasons, converted to a physical or body symptom. So traumatic experiences becoming body experiences, and only that, right? So I think this is where this was a progression from it being a wandering uterus, for sure, progression from hysteria, you're just a crazy woman, but still limited to just psychological factors influencing the body. So then we move into the era that that we're in now, thank goodness, of really trying to understand this a little bit more. And actually, honestly, some of the early roots of understanding this from a neurobiological, a circuitry issue did start in the era of Charcot. I've talked about this before. He conceptualized functional neurologic disorder as a oh my gosh, the word escapes me, but like a moving lesion, a dynamic is the word, dynamic lesion in the nervous system. What we know now, and what's cool now, is that we have evolved so that our imaging can capture that through functional MRI. So that is what has evolved us to really understand the circuitry issues here. So, and there's a lot that we know now. And I'm going to talk about a little bit of that neurobiologic understanding, but now we're beyond hysteria, we're beyond conversion disorder, we're certainly beyond a wandering uterus, and understanding the circuitry issues that have come up in functional neurologic disorders. And that really brings me to the second article. By the way, the whole thing is so good. The whole special issue, functional neurologic disorders and functional seizures. This article, Cola and Lefevre, great leaders in the field here. Functional movement disorder and functional seizures. What have we learned from different subtypes of functional neurologic disorders? So in this paper, they were really comparing and contrasting functional movement disorder and functional seizure, highlighting some of the important differences, but also similarities and the approaches with them. And I really liked looking at these side by side and some of the insights that they brought. And I do think there's some that we can continue to learn and grow here. I'm just going to look in the comments here. Catherine and Jamie commenting on the Egyptians being ahead of their time for sure. And Danielle, thanks for sharing, has functional seizures diagnosed in September. And so Danielle, I'm going to highly recommend this particular series of research articles because I think there's a lot to be learned about functional seizures in them. So one of the things therapists ask me a lot as a physical therapist, like, what are you doing with a functional seizure? Like, maybe I'm used to functional movement disorders because there's a movement difficulty, but a functional seizure is different. And I think one of the things that we see in functional movement disorders and the authors highlight is that person's going to experience abnormal movements on a daily basis, whereas somebody with a functional seizure is going to have maybe episodic series of events that occur. Now, what I would say, and this is actually not what the authors talk about, and I think this is an area to really grow because I think physical therapy, occupational therapy can have a really big role in functional seizures, is that there's a lot that we can understand from the body from an autonomic standpoint, sensory standpoint, lifestyle, psychosocial, motor control that might be contributing triggers to the functional seizure. Now, the authors talk about how in a traditional way, from a treatment standpoint, most people with functional seizures are primarily treated with a psychologist or psychiatry, whereas a person with functional movement disorders, it tends to be more of a multidisciplinary approach. Now, that is what's kind of out there now, and I would say that's a problem, to be honest. I really think for the person with functional seizures that there is a lot to be learned by working with that whole team approach. So yes, getting that psychological insight and input, absolutely. Having that occupational therapist who can really help you understand lifestyle triggers, having the physical therapist that can help you understand physical triggers, motor control, sensory triggers, autonomic. And in fact, for us, our OT, our occupational therapy team really works on that as well. Our yoga therapist does a really great job of blending those pieces together, that mind-body piece as well. So I would argue, though it's not the standard of care, I would argue that integrated team approach is really beneficial for those with functional seizures, just as beneficial as functional movement disorders. I'm going to let my dog out here. Dogs get excited when I get excited and I'm talking. So I will apologize for having to move around here for my dogs. So that is some of the pieces that are different, but I would argue maybe should be similar in functional movement disorders and functional seizures. Now, one of the things that getting to the circuitry, kind of where we are in our understanding, a lot of advances in both functional movement disorders and functional seizures in understanding some of the disconnect. I've talked a lot about this before. In functional movement disorders, we've got right temporal parietal junction hypoactivation, decreased connectivity to other areas of the cortex that produce volitional movements, increased amygdala activation in functional movement disorders, also decreased supplementary motor area activation. So we know there's a lot of potential connections there. In functional seizures, there are also some areas that have maybe gone awry in connection. There's structural and functional abnormalities seen on imaging in functional MRI, um, increased connectivity between brain areas for emotional processing and executive control and movement. Similar, not exactly the same, but similar to functional movement disorders. And again, there's only a few studies and they're small. So there's a lot of area of work to be done here. But also another study in functional seizures have found abnormal circuitry between emotional, subcortical, and sensory motor control. This actually tells me yet again why you should have an integrated team for functional seizures, because this potential pathophysiology and the changes in the brain lie in these areas that can really benefit from treatment, um, and that brain body connection. So very important. The third article I wanted to talk about from the series was really interesting and really like hit home for me because I'm so passionate about talking to other therapists and training other therapists in different areas. This one was called Neurology Residence Education in Functional Seizures. And it was from a really diverse group from several different academic institutions. And they reported a survey of neurology residency program directors and recent graduates about the education that they got during residency on functional seizures. So helpful because we kind of want to know, what are people getting and what do they understand? Now, granted, they only got 17% of responses. So we know this is a limited sample here. But here is some of the results from that. So most frequent setting for education was if they was on a clinical rotation of an epilepsy monitoring unit. So that makes sense because that's where that diagnosis would be coming, and having a single didactic lecture as well. The majority of programs didn't provide a curriculum for training and for feedback and best practices for communicating diagnosis. This is so important. I hear over and over again of just really traumatic experiences of being told what the diagnosis is and that it's all in your head. Perhaps this is because people aren't being trained in how to do it. 77% of the people also responded that they weren't taught about treatment. And we know and we understand that functional seizures are just as disabling and just as scary as an epileptic seizure. So we should all be understanding the treatment as well and helping people get connected to the treatment. So this definitely shows a hole. It's not a surprising hole. I think it's a hole in many different curriculums, including physical therapy, including psychology. A lot of psychologists are trained in understanding conversion disorder still as well. So there's a hole there, and the authors make some suggestions, and they suggest an integrative, evidence-based, and multi-specialty curriculum in functional neurologic disorders. Like, hallelujah, that is exactly what is needed and what we need to improve people's confidence and comfort in addressing the diagnosis, providing the diagnosis, making good recommendations for treatment, understanding what physical therapists and occupational therapists and psychologists and a whole team can do for the person with functional seizures would be so important. One of the things they actually point to is the Functional Neurologic Disorders Society, FNDS. Great resource if you're not familiar with it. I actually just got out of a meeting with our fellow, and we're going to work on to present a case presentation for this the upcoming annual conference for the FNDS. Super excited. We're going to present a case with functional seizures amongst other symptoms. So that's the thing is a lot of the people that we've worked with have functional seizures and other functional neurologic disorder or functional movement disorder symptoms. So stay tuned. We'll let you know if that gets accepted, and we'll be doing a lot of work on it, which is really exciting. So there you have it. I hit on some of the key topics from this special issue of Epilepsy and Behavior journal that looked at a special theme of functional neurologic disorders and functional seizures. We talked history, why it's not just conversion disorder. We compared functional movement disorder with functional seizures, and we talked about the training and understanding of functional neurologic disorders and what needs to be done. There's so much more, so I might do another one of these because there's a lot in this field and a lot in this particular special issue journal. So I want to thank you for joining me today in this curiosity-driven exploration of functional neurologic disorders. If you're not already on our newsletter, I'll send out a link to this, but our newsletters, you can sign up at reactiveeducation.com or reactivept.com if you're a person with a neurologic disorder. I'll send out the links to all of the articles that we talked about today, and we'll send out the videos too that we do, so you have a copy of that. But I hope you have a wonderful, wonderful Friday. Thanks for joining me live today too. That was fun, and I will catch you soon.